Hey everyone, today we're going to talk about something that comes up in a lot of pregnancies, gestational diabetes. Now, if you've recently been diagnosed or you're just curious, the first thing I want you to hear is that this is common and more importantly, it's totally manageable. We're going to break it all down in this explainer.
So, just how common are we talking? Well, take a look at this number. According to the International Diabetes Federation, gestational diabetes, or GDM, affects about 1 in every 6 live births around the world. That's a lot. It really shows you just how many families this touches.
So here's our game plan. We'll start with what GDM actually is, a simple definition, then we'll get into the cool science of why it happens. After that, we'll walk through how it's diagnosed, talk about the plan for a healthy pregnancy, and finally, look at what it means for your health after the baby is born.
All right, let's start with the absolute basics. What exactly are we talking about when we use the term gestational diabetes?
The most important word here is gestational. This means it's a type of diabetes that shows up for the very first time while you're pregnant. Basically, your blood sugar or glucose gets too high. But for most people, and this is key, it's a temporary thing that goes away right after you give birth.
So, does anyone get this?
Well, it can happen in any pregnancy for sure, but some things can increase your chances. We're talking about factors like your pre-pregnancy weight, if you have a close family member with diabetes, or if you've had GDM before. Things like PCOS or high blood pressure can also play a role. It's just a combination of things that can set the stage for it. Okay, so that's the what, but what about the why? Why would a totally natural thing like pregnancy cause your blood sugar to spike? The biology behind it is actually pretty amazing. So to get this, we have to talk about something called insulin resistance. Think of it like this. Insulin is the key that unlocks your body's cells to let sugar in for energy. With insulin resistance, the locks on your cells get a little sticky. The key doesn't work as well, so your body needs to make more keys, more insulin, to get the job done.
And this is where the placenta comes in. It's the real driver here. Your placenta is working hard, pumping out all these hormones to help your baby grow. It's fantastic for the baby, but these same hormones have a side effect. They're the ones making your cell locks sticky. It's actually a clever biological trick to keep more sugar in your bloodstream so it's easily available for the baby. Most of the time, your body just ramps up insulin production to handle it. But if your pancreas can't quite keep up with that demand, your blood sugar rises. And boom, that's gestational diabetes.
So if all this stuff is happening on the inside, how in the world do you find out if you have GDM? That brings us to testing. The timing for this is pretty standard. If you have some of those risk factors we talked about, your doctor might test you early on. But for pretty much everyone else, the screening happens between 24 and 28 weeks. Why then? Well, that's when those placental hormones are at their absolute peak, making it the perfect time to see how your body is handling the sugar. Now, how the test is actually done can be a little different depending on where you are. There are two main ways. The one-step method is exactly what it sounds like. One test, and you're done. The two-step method starts with a shorter 1-hour screening. If that one comes back high, you'll go back for a longer 3-hour test to confirm it. Both methods work great. The goal is just to get an accurate picture. All right, let's get to the most important part. Because getting a diagnosis isn't just about knowing you have something. It's about starting a proactive plan to make sure you and your baby stay healthy. And the foundation for managing GDM is all about lifestyle adjustments. We're talking about working with a dietitian on your food choices, getting some moderate exercise, even just a walk after meals makes a huge difference, and checking your blood sugar at home to see how you're doing. For a lot of people, these changes are all it takes to keep things in a healthy range. But sometimes diet and exercise just aren't quite enough to get those numbers where they need to be. And that is perfectly okay. In those cases, we have safe and effective medications. Insulin has always been the gold standard because it doesn't cross over to the baby. But there are also pills, like metformin, that can work really well. Your healthcare team will work with you to find the best and safest option. So why is all this management so important? Well, it's all about reducing potential risks. For mom, uncontrolled GDM can increase the chance of things like high blood pressure. For the baby, the biggest concern is that all that extra sugar can cause them to grow extra large, which can make delivery more complicated. It can also cause some temporary issues for the baby right after birth, like low blood sugar. The great news? Managing GDM well dramatically lowers all these risks. Okay, on to our last section. The story of GDM doesn't just stop when the baby is born. We've got to talk about what it means for your health down the road. And here's the best news of all. Once the placenta is delivered,
that source of all that crazy insulin resistance is gone. For the vast majority of women, blood sugar levels zip right back to normal, sometimes within just a few hours. A huge sigh of relief. But, and this is a really big but, having GDM is like a sneak peek into your future health. That stress test of pregnancy revealed that your body might have a tendency towards diabetes. In fact, having GDM can increase your lifetime risk of developing type 2 diabetes by up to 7 times. That's a huge number. Now, I know this graph looks a little intense, but it tells a fascinating story about why that risk is higher. Think of it like a car's engine. The dotted line is a perfectly tuned engine. The solid purple line represents women who've had GDM. You can see it's just a little bit lower. It means that even after pregnancy, their body's insulin engine isn't quite as efficient as it used to be. And that small difference is what creates that long-term risk.
And because we know this, follow-up is absolutely crucial. Everyone who had GDM should get another glucose test about 4 to 12 weeks after delivery. This is just to make sure your blood sugar is back to normal and to get a baseline for your future health. So I'll leave you with this thought. What if we stopped thinking of gestational diabetes as a disease and start thinking of it as an early warning system? It's a unique opportunity, really. It gives you an early look at your future health, empowering you with the knowledge to make choices that can keep you healthy for years and years to come. Thanks for tuning into this explainer.